As we've discussed, one of President Biden's biggest challenges is COVID-19 as he rolls out his new plan to combat the virus. The COVID tracking project reported more than 4,400 deaths yesterday. That brings the death toll in the U.S. to more than 407,000 people, with more than 24.4 million people having been infected. Meanwhile, efforts to slow the virus are starting to hit a wall. As CBS News national correspondent David Begnaud explains, some states are running out of vaccine doses.
As vaccination sites get bigger and busier around the U.S., more elected officials are saying the same thing to the federal government.
Double, triple what you're sending us. We're ready to provide the vaccines.
That's the Detroit mayor, Mike Duggan. He says he has the full capability to get his city fully vaccinated in 3 months, but he's just not getting enough vaccine to do it.
We've got the convention parking structure where we could handle 25,000 vaccinations a week. And right now we're scheduling 6,000. We have Pfizer right up the street in Kalamazoo, and they tell us they've got vaccines the federal government hasn't purchased, but their agreement will let them sell them to the states.
So far, only 22 states and the District of Columbia have used more than half of the doses they've received. But remember, both the Pfizer and Moderna vaccines require 2 shots. And to make sure they have that second shot set aside, some officials are halting new vaccinations. That's exactly what happened at Baptist Health in Miami. They canceled all appointments for their first vaccinations because their expected allocation did not arrive this week. In San Francisco, officials say they're going to run out of doses today. In New York City, Mayor Bill de Blasio says they have the capacity to vaccinate 300,000 people a week. But they're going to begin to run out of doses today, too.
We've had to tell 23,000 New Yorkers who had an appointment this week that they will not be able to get that appointment for lack of supply.
Rivka Press-Schwartz was one of those who lost her appointment. Schwartz is a high school administrator in the Bronx.
It creates anxiety and maybe even a little bit of a sense of panic. I don't quite understand scheduling appointments for which you didn't have doses.
Fair point. Listen, regarding what the mayor of Detroit said about Pfizer being right up the road and having more vaccines that they could sell to the state of Michigan, but they won't, we reached out to Pfizer, which said, hey, listen, we'll be more than happy to sell to Michigan, but we need the federal government to give us the approval to do so. The Biden administration says next month they're going to start shipping vaccines directly to local community pharmacies around the country, and that should make a big difference. David Begnaud, CBS News, East Lansing, Michigan.
Joining us now is CBS News MoneyWatch senior reporter Stephen Gandel. Hi, Stephen. Great to see you. So what is the main problem with the vaccine rollout? It seems like there are several issues, from the point of departure through the states receiving them, through the administration of the vaccines. What's the main problem and what needs to be done to fix it?
Well, the main problem, I think, is coordination. It's going slow by all accounts and by the numbers, but it's going unevenly, right? And so what you see some people traveling from states where it's going slow, maybe New York, to states that are more open, Florida. And on the West Coast, many people are traveling to Colorado. And that not only creates confusion, but it also creates equity issues that people that can't travel, can't afford to travel, they can't get access to the vaccine. So what experts have told me is that this plan, which was the Trump plan, was to turn it all over to the states and let them manage it the way they want to. It's not worked. And so the experts tell me that it's very good news that the Biden administration plans to bring in FEMA, bring in more of the National Guard to get the distribution going.
So let's talk about that, because initially the vaccine rollout plans didn't include using the help of National Guard. You say now that's sort of welcome. The states are welcoming it now. But there was concern that this military presence might scare people away. It seems that other concerns are now overweighing that. But how are states rethinking the role of the National Guard? And is there the risk that people will not feel comfortable getting their vaccine from, National Guard troops rather than a doctor or nurse or a medical professional?
Yes, the idea that no one liked the idea that their city was going to look like a military, like it was occupied. People thought that there was the thought, especially from the Trump administration, there was so much misinformation, this was going to make it even worse. It was going to open it up for more. But we've seen so much doses sitting on the sidelines, this sluggish rollout, that the overwhelming thought from health experts, from those who study health outcomes, that getting the vaccine into people's arms is the best way to stop the spread of the disease and stop the growing death count. And it's worth, right now, it's worth the risk. That's what I'm told. It's worth the risk that some people are turned off to get the vaccine to the people who want it. And right now, the demand is so high that you're not likely going to turn people away. We still probably have far more vaccine to distribute than we have people that want it.
Yeah, I hear far more people are desperate to get the vaccine than who are afraid of getting the vaccine. But how will this work with the National Guard? Are they going to be training troops how to, inject people with the vaccine? Because obviously not everyone can do this, right? You have to have some kind of licensing in place. So as a practical matter, how will that work?
Well, in some states, they are giving vaccines. As a practical matter, most of the time it's set up, it's logistics. But they are doing a lot of things, whereas originally it was thought that you wouldn't see the National Guard. They're going to be doing a lot of things at these mass vaccination sites. They set them up. The Jacob Javits Center, which has now gone through its second renovation, if you remember, it went through it became a COVID hospital at the beginning. Now it's becoming a vaccination center. Their National Guard troops are going to do everything from checking people in, making sure you're getting on the right line, ushering you to where you'll get a shot. And New York State says that when that's up and running, people can get in and out of there in 30 minutes. So they're going to doing a lot of the process. In some states, even in Maryland, they're going to be giving shots, but it's more the logistics. And also a lot of states are now naming either retired or on duty National Guard generals to manage their process, whereas before they had been leaving that up to pharmacies or hospitals. There's a greater sense that centralized management is needed at all stages here.
Right. All right. Well, let's hope it works. Stephen Gandel, thank you so much for joining us.
Thank you.